Hi everyone, my name is Coddington and this is my articulation video and final project. During this video, I will discuss my program and institutional outcomes and the portfolio projects that I have attached to these outcomes. I will break down each outcome, the projects that demonstrate my mastery of these outcomes, and the knowledge, skills, and behaviors, or the why, how, and what, that were developed and strengthened during these projects. For the first program outcome, demonstrate competency to assemble, process, maintain, store, abstract, analyze, index, and retrieve health information data, I have attached these 5 projects: my electronic health record abstraction, my ICD-10 PCS training video, my inpatient versus outpatient PowerPoint, my coding audit tool and schedule, and the accurate and complete documentation presentation. I attached the electronic health record project because I had to abstract information from a patient chart to complete this. The PCS training video was included here because health information data was retrieved to put this project together. The next project was attached because I processed, analyzed, and assembled the pieces of both inpatient and outpatient coding to compare them. The audit tool and schedule were created to help retrieve health information and data to stay compliant. The project on accurate and complete documentation was attached to this outcome because it required analyzing and indexing health information. These projects meet this outcome because they demonstrate my ability to take relevant health information data, put it together in an organized way, and share it in a logical manner. In doing so, I gained knowledge of patient charts, differences of inpatient and outpatient coding, the expectations of an audit and how to play an active role in preparing for one, and what accurate and complete documentation in a patient chart looks like. This knowledge will help me articulate what I know in interviews, and then I will use it to understand clinical documentation and create medical codes from this documentation. The second program outcome, analyze the results of aggregate coded data to report findings and trends, is attached to my accurate and complete documentation project. For this project, I had to research what accurate and complete documentation is, as well as how to create it. This project entailed communicating this in an easy-to-understand way and including best practices to achieve accurate and complete documentation. I increased my knowledge on what the expectations are for documentation in a patient chart that will help my awareness in the future as a medical coder. The skills and knowledge that I learned through completing this project will be used in the future because I will feel confident in knowing that either there is information missing from the patient chart or that all of the information that I need is there to complete the most accurate codes. The third program outcome, abstract information from medical charts to assign the correct diagnosis, procedure, and supply code in a variety of medical situations, is attached to these 5 projects. My patient report, patient assessment, medical coding systems PowerPoint, coding a patient chart, and coding an audit projects all show my ability to take information from a medical chart, analyze and process the information, and assign the correct medical codes. With these projects, I created a patient report, coded a patient chart, and performed a coding audit from patient charts from different settings. The PowerPoint required analysis of the classification systems and how to code for each. These projects gave me practice utilizing medical records to create coding outcomes for reimbursement. They helped me better understand documentation and how to use it. I will use this knowledge every day as a medical coder as I abstract multiple patient charts and translate it to coding language. The fourth program outcome is to evaluate the accuracy and completeness of a patient record as defined by policy, external regulations, and standards. I have 3 projects attached to this outcome. They include a coding audit tool and schedule, a coding audit email, and accurate and complete documentation presentation. To create each of these projects, I had to research and understand what must be included in a patient record for it to be considered accurate and complete. It was also necessary for me to know which rules and regulations pertained to this concept and communicate it in a clear and easy to understand way. The knowledge gained while demonstrating this outcome will be important in my future career as a medical coder. It will guide me to correct and accurate coding and gives me a better understanding of what to do if there is missing documentation. Now we will move on to the institutional outcomes. The first of these is to utilize appropriate technology and resources to locate and evaluate information needed to accomplish a goal, and then communicate the findings in a visual, written, and/or oral format. Each of the projects listed are video presentations. Each required I learn and modified my skills using technology. Some incorporated additional technology such as Excel and Screenomatic. When I began my education here at Bryan & Stratton, I didn't even have an updated computer. Through these projects, I have learned the most updated technology. With my experience creating these projects, I now feel confident in my ability to learn how to use new technology and how to continue to demonstrate my ability to use the current technology. I look forward to showing off these skills in the future, in my future career, and I know that I can do it in a smart, organized, and visually pleasing way. The next institutional outcome is to transfer knowledge, skills, and behaviors acquired through formal and informal learning and life experiences to new situations. There are 5 projects attached to this outcome. They include my student loan project, from which I was able to use both my old and new math skills as well as previous life experiences to learn, understand, and create a plan for paying back my student loans in the future. This is something I never learned before and will make a positive financial impact on me and my family in the future. For my career development research paper, I was able to take my knowledge of potential future careers as well as my own self-awareness to compare careers and decide which would be the best fit for me and my family. The patient coding scenarios, coding audit email, and the clinical documentation projects allowed me to use knowledge obtained here at college, as well as my previous experiences in the medical industry to these new coding situations. These are skills that I will use in medical coding daily. There will constantly be new situations which will require me to use my knowledge of coding and other learning that has taken place here at Bryan & Stratton and combine it with my previous life experiences to new situations. Employ strategies for reflection on learning and practice in order to adjust learning processes for continued improvement is the next institutional outcome. Here, I attach my career path reflection, my career development research paper, and my student loan project. For these 3 projects, I was able to reflect and improve drafts throughout each course based on my learning. Through this practice and these adjustments, I achieved projects that both met my learning objectives and made an impact on my life. I now feel confident and excited with my career choice for the first time in my life. I also feel assured with the plan that I created for paying back my student loan in a financially intelligent way. In any career, it is vital to have the ability to self-reflect and adjust accordingly. This is how we grow as a person and an employee. I know I will use this skill regularly in my future career, and it will make me a valuable employee. Institutional outcome number 8 is to follow established methods of inquiry and math reasoning to form conclusions and make decisions. This institutional outcome was met with my student loan project. With my student loan project, we used actual loan amounts and made decisions about how much we could and wanted to pay monthly on those loans. These choices dictated how long and how much we would be paying overall for our schooling. From here, we adjusted and created a final plan. I will use these skills in the future as a medical coder anytime I need to inquire about something before coding. The methods used for my student loan project will be used to make the best decisions regarding patient records. The next outcome is to participate in social, academic, and professional community for individual growth and to function as a citizen in a multicultural world. For this outcome, I just had one portfolio project attached. This is my student loan project. I attached this project because being financially responsible is part of functioning as a citizen in a multicultural world. The tools I learned while working on this project will improve my finances and help me become a more responsible citizen. I know that this presentation is focused on my portfolio projects and how they relate to my program and institutional outcomes. However, I feel that the weekly discussions as well as our interactions within the professional community are appropriate to mention here as well. Every week for nearly 2 years, I was required to create a discussion post and interact with at least 3 of my classmates over at least 3 days. Not only did this experience allow me to get to know my classmates, despite never having met them in person, it also gave me an opportunity to learn a huge amount about respect, listening, and valuing others' thoughts and opinions. I cannot think of anything more important to learn right now than that. The connections I made during these weekly discussions will be the thing I miss most about the Brian and Stratton experience. This social and academic aspect will help me make connections in the workplace with people both like me and people different than me. Additionally, although I do not have a job as a medical coder yet, I already feel part of the professional community. This is due to the involvement that my teachers and advisors encouraged and expected, along with their guidance and the tools to be part of medical coding associations like AHIMA. This feeling of inclusion has given me the confidence to apply and interview for my dream job as a medical coder, and I know that I will be a valuable employee due to these experiences. The last of the outcomes is under Other. I had 2 projects that I added additional outcomes for. These projects demonstrated my knowledge of concepts and processes of diseases and conditions, relate the causes and mechanisms of diseases with the associated diagnoses, treatments, and medications typically prescribed, and process, analyze, and understand the body systems, their functions, and how they work together to maintain health. This knowledge will be used every day as I abstract information and connect it to the appropriate medical codes. The projects attached to these outcomes include my patient report as well as my patient assessment. With all the portfolio projects that I created and attached to the various outcomes, I developed valuable skills and behaviors. I've become very good at researching. With every one of these projects, I had to conduct some type of research. Some of them required old-fashioned research with library books. Others, more modern research by determining which internet sources were reliable and abstracting the relevant information. Research is something I will need to do regularly as a medical coder. I will never know all of the medical terms used in patient charts. Google will continue to be my best friend as I embark on my future career. Another skill that I learned with every one of these projects is perseverance. I can tell you that there were points in all of these projects that I just did not want to put any more effort and time into them. This was especially true a year ago as we entered a global pandemic that we are still dealing with. I had to make a conscious decision that my education is worth the late nights and long weeks, even during these really intense times. I took a collective deep breath and just got it done. Perseverance is a valuable skill in the workplace as well. There will be tough days at workplaces, and all workplaces want employees that can get through the hard days and grow because of those hard days. These projects also taught me how to read and process patient charts, abstract all relevant information, and translate it to coding language. Obviously, these skills will be used daily as a medical coder with the typical job duties and expectations. Lastly, these projects have taught me important behaviors. I learned that a positive attitude can change everything. When I would feel frustrated or just feel bad about missing out on something because I had to work on a project, I would remind myself how truly lucky I am to be in school. There are so many people out there that wish they had this opportunity. Over the last 2 years, I have developed a determined mindset. There were plenty of weeks when I did not know how I would get all of these projects done. I learned to focus and get it done. Not finishing was not an option. That determination has seeped into many other parts of my life, and I feel really proud of that. I've also developed better time management skills as I worked on these projects, as well as organizational habits to help me meet these time management needs. These behaviors will easily transfer to the workplace. They are life skills that will be beneficial to all future employers. In conclusion, my portfolio projects have given me valuable skills, knowledge, and behaviors. Each one served an important purpose. Together, they have helped me become a valuable employee and a better person. I am more well-rounded because of them. The experiences that they have given me will stick with me the rest of my life. I could not have asked for a bigger impact than that from my schooling. I am lucky to now call myself a Bryan and Stratton alumni.